Hi guys, it's Amy Furno again. I'm just going to go through a couple of basic things for your first call shift and doing well when you're on call. I know that the Intern podcast from Behind the Knife is really good. I listened to that pretty recently and it covers a lot of stuff. So that's a good resource. This will just go through a few quick things, kind of specific to Mount Carmel, also kind of general. So, on your first call shift, the key to everything is going to kind of be these things here. So having your list printed at the beginning of the night, you're going to need a trauma list, a general surgery list, and a clinic list. And you're going to need to have that with you all night, and hopefully it'll have some notes on it that'll be helpful, your notes, and of course the list notes. You will need to get the pager from whoever had it during the day, the East pager, and make sure they don't go home with it because sometimes that happens. And make sure you get good sign out. I think at the beginning of intern year, sign out is really important because it can help you build trust with the nurses. You know, when you call and you're familiar with names, and you can respond quickly and with familiarity to the patients, it really helps build trust with new people, which I think is reasonable. So sign out is really important in your first couple of shifts. So make sure that you write everything down during your first call shift, when you get new consults, when you give verbal orders, and just stay organized, and that is going to be key to everything on call. Staying organized, writing things down. I think the podcast says something along the lines of an intern is only as valuable as his or her pen, which rings so true. So, like I said, when you get sign out, take notes. Most of the important things will already be on the list, but go ahead and when people are signing out, think ahead. If someone says, oh, this person's having delirium overnight, say, okay, well, what has worked for them? Has Haldol worked? Has Seroquel worked? What do you prefer that I do if they become delirious again? And then if you need to do checkups overnight, go ahead and highlight them, and then when you do check up on them, write a brief note. That can be really helpful, especially if you're doing interventions. And then always ask the question, is there anyone you're worried about? Is there anyone I need to be looking out for overnight? So at the start of your shift, the ICUs at East are kind of spread out, but they're mostly on 3N and 4N, so it's really helpful to walk around the ICU, especially if you have some sick people on the list. And you can do that with your senior, because your senior will be taking most of those calls for the ICU patients, but it's good for you to be involved and to be familiar. And then, of course, make sure you check in with your senior. You're going to be hanging with them for like the whole call shift, for most of the time. So make sure you find them. So when you get a new consult, which you inevitably will during your call shift, make sure that you write it down, because I promise you will not remember it in 30 seconds. You will not remember it when you hang up the phone. You can always take a beat. If you're walking, just go ahead and stop, and you can tell the person on the phone, okay, 1 second, let me get ready, I'll write it down. And you can ask spelling. Some of these are really hard to spell, or if they have a really common name, you can ask date of birth, but you need to make sure you get the right information and the right room number. So once you get that consult, you'll go to wherever it is, probably in the ED, and you'll get a sticker for yourself and a sticker for your senior, and you'll go through, the basic things that they talk about in that Behind the Knife podcast, like doing a good history and physical, and reviewing all the labs and imaging, and thinking ahead to a plan too. But every single time you see a consult, you'll need to make sure that all these things are done. So I always write down molds, and I have a patient sticker on my paper for each consult I see, and I think that's what most people do. So the first thing that you'll do in molds is really the list. So usually either before I see a patient or right after I see them, I make sure that they're on both the power chart list and the Citrix list. And of course we'll show you how to do these things, but there are two lists they'll have to be on. And then you'll see the patient. You'll go through all of your usual stuff that you were trained to do, And then afterwards, you'll talk about it with your senior and with the staff member. And once that's done, if it's determined that we're going to be primary and we're going to admit, then you'll need to make sure the orders are put in and that the med rec is done so they're getting their home medications. And finally, you'll have to dictate the consult. So these things have to be done every single time, not necessarily in this order, but I make sure and put check marks by every single one of these letters every single time. So you can get really busy and it can be easy to miss things. So writing everything down is important. If you are getting a trauma consult, it can be called moldies because there's the additional thing in the trauma bay over to the side farthest away from the ED doors. There are yellow cards, which are for billing, and for trauma consults, we fill those yellow cards out and we put a sticker on them and then we put them back in the box. So for trauma consults, it's moldies. So if you get a new consult and you see it and you are great and you've done all of the molding, then there's still some things you need to make sure are done. And most of these are just communicating, which can be harder than it seems because sometimes finding these people can be difficult. But it's important that you talk to the nurse, especially if there's things that are going to need done, like having an NG tube placed or having a Foley placed. These things have to be discussed with the nurse, and you need to make sure you talk with them. Then you need to talk with the ED doc if this is the consult in the ED, and let them know if you're admitting or not admitting, because that really is going to matter. Or if it's a consult on the floor, you may want to talk to the consulting physician, kind of depending on hours and if it seems necessary at the time. But definitely if you're in the ED, you need to talk to the ED doc and let them know your plan. And then talk to any consultants. For example, if you have a trauma consult come in and it's a C3 fracture and you're consulting neurosurge, you need to talk to neurosurgery. So that would be important. And then double check your molds again, make sure everything's done. And then at some point during the night, make sure, after you do your dictation, you'll get a confirmation number and you'll write that down. And then make sure that your dictation number goes through. So usually I have my molds and my patient sticker, and then I have all my notes. And then at the bottom, I write my dictation number, the confirmation number. And at some point in the night, when I see that in my inbox, I put a check mark by that dictation number to make sure that everything worked and it didn't get missed by the dictation people and you don't have to make any phone calls. And then the other thing during call that is huge and can get really crazy is trauma alerts. So what do you do if you hear a trauma alert? If your pager goes off, it says trauma alert. You have to stop whatever you're doing and go to the trauma bay. So even if it says ETA 8 minutes, I would just go right away. Pretty much whenever you hear trauma alert, go to the trauma bay. So once you get there, you're going to put on your lead, and especially make sure you have on your thyroid shield and all of your protective gear and your gloves. And you'll probably be at the feet, and your senior will be at the head, and you'll kind of go from there. And there's a trauma lecture. That's great, so listen to that. If it gets to be morning on your call shift, as it inevitably will be, and you get a new consult and you're trying to round, keep in mind that the call team is still responsible for new consults until your call shift ends, whether it's during conference, up until conference on weekdays, or till 8 on weekends. So you have to sort of stop rounding and focus on the consult first. Rounding comes second. So if you are going to be too busy with consults coming in the morning to see any of your people, or if you're not going to be able to see everyone, just let your team know. They may say, okay, you'll see them after conference, or they may say, oh, okay, we're not too busy, we can help you out. Just will depend, but just communicate. Once it is morning and your call shift is over, make sure that you're transferring the pager properly. So on weekdays, you give it to the day team at conference, and on weekends, you are just going to have to communicate with the next person coming in, and technically handoff should be at 8 a.m., but just sort of communicate and make sure that, you may have to track them down when they're rounding or so on, which is fine. So once you are done with call, um, you know, how do you learn from it? How do you get better at call? So it's very wise to make a separate power chart list for like your on-call patients. So anyone who you admit or a consult that comes in while you're on call, you can put them on this list and then look back and see what happens afterwards. See if any plans were majorly changed, see if anything that you thought the diagnosis was actually very different, and just try to learn from it. That can be a really helpful strategy for improvement. And then also ask your senior if there's anything you can do better, um, and look for feedback. And that is it. I think most everything else is covered in the Behind the Knife podcast, which is really helpful. But these are kind of some basics for what to do on call. And keep in mind that you can always ask for help from your senior. And like I said, your senior will be with you pretty much the whole time you're on call. And you can always call attendings. And you can always ask for help, so you're not going to be alone at any point in this. Okay, that's all I have. As always, let us know if you have any questions.